Hello and a very warm welcome to Rajya Sabha TV. I'm Tina Jha with News Tonight, where we get you the day's biggest news stories from across India and the world. Super Cyclone Ampan is likely to make landfall between Digha in West Bengal and the Hatia Island in Bangladesh, close to Sundarbans, on Wednesday afternoon. The cyclone will hit the coast with a maximum wind speed of 155 to 165 km per hour, gusting to 185 km per hour. According to the IMD, Cyclone Ampan moved north-northeast in 6 hours till 5:30 am at a speed of 140 km per hour. The India Meteorological Department said it is very likely to weaken into an extremely severe cyclonic storm in the next 6 hours after its landfall.
The super cyclone Ampan is now located at about 480 kilometers south of Paradip and 630 kilometers southwest of Digha. It is expected to move north-northeastwards and cross West Bengal Bangladesh coast between Digha and Hatia Island close to Sundarbans tomorrow, the 20th May, afternoon and evening time. At the time of landfall, the wind speed will be 155 to 165, gusting to 185 kmph. This wind speed is very dangerous. It can cause large-scale damage.
The Met Department warned that the cyclone could cause widespread destruction in East Midnapur, South and North 24 Parganas, Havra, Hooghly and Kolkata districts in West Bengal. Odisha could face extensive damage from the storm that is likely to uproot communication and power poles. Rainfall commenced over coastal Odisha since early hours on Tuesday. However, the rainfall intensity is likely to increase gradually and touch its maximum peak by Tuesday night and Wednesday afternoon. In view of the impending cyclone, 12 coastal districts of Odisha have been put on high alert. Coastal districts of West Bengal could experience light to moderate rainfall at several places starting Tuesday. The IMD also said Cyclone Ampan could also disrupt rail and road links in many places in Bengal and Odisha and extensively damage standing crops, plantations and orchards. As Super Cyclone Ampan advances towards West Bengal and Odisha, Home Minister Amit Shah on Tuesday spoke to chief ministers of both these states.
The Home Minister assured both CMs of all possible help. In a telephonic conversation with Mamata Banerjee, Amit Shah discussed the arrangements and preparedness in West Bengal, where the cyclone is expected to land on Wednesday. The Union Home Ministry is in continuous touch with both state governments. Cabinet Secretary Rajiv Gauba also chaired the third meeting of the National Crisis Management Committee to review preparedness of states, central ministries and agencies to deal with Cyclone Ampan. Chief Secretary of Odisha and Additional Chief Secretary of West Bengal apprised the National Crisis Management Committee of preparatory measures taken by them. They informed that evacuation of people from the low-lying areas is being carried out. They also informed the committee of actions that have been taken to stock food, grains, drinking water and other essential supplies. Teams for maintenance and restoration of power and telecom services have also been positioned. Reviewing the preparedness of states and central agencies, the Cabinet Secretary asked state governments to ensure timely and complete evacuation of people from low-lying areas in the cyclone path and maintain adequate quantities of essential supplies such as food, drinking water and medicines. Indian Coast Guard and the Navy have deployed ships and helicopters for relief and rescue operations. Army and Air Force units in West Bengal and Odisha have also been put on standby. NDRF has deployed 25 teams in Odisha and West Bengal. Additionally, 12 teams have been kept on standby. NDRF teams have been carrying out awareness drives, communication drives and evacuation in Odisha.
अभी फिलहाल 15 टीम उड़ीसा में हैं जो कि डिप्लॉयड हैं और ज़मीन पर काम शुरू कर चुकी हैं अवेयरनेस ड्राइव का, कम्युनिकेशन का और इवैक्यूएशन का। 19 टीमें वेस्ट बंगाल में ग्राउंड पर हैं और 2 टीमें वेस्ट बंगाल में रिजर्व में हैं। इस तरह 41 टीमों का टोटल डिप्लॉयमेंट दोनों राज्य मिलाकर है, अगर रिजर्व को भी हम लोग मान लें। ऐसा पहली बार हुआ है कि एक तरह से 2 डिजास्टर्स हम लोग एक साथ फेस कर रहे हैं। पहला डिजास्टर ऑनगोइंग है, कोविड-19, जो सब आप समझ रहे हैं, और उस माहौल में, उस परिप्रेक्ष्य में ही एक दूसरा डिजास्टर हमारे सामने है जो साइक्लोन की शक्ल में है। सो अगर उसको शॉर्ट में कहा जाए, इट इज साइक्लोन इन द टाइम ऑफ कोविड। सो ये डुअल चैलेंज हम लोग फेस कर रहे हैं और उसी के अनुरूप हम लोग कार्रवाई कर रहे हैं।
Odisha started evacuating people on Monday evening and the operation is expected to finish by Tuesday night. Odisha has about 560 permanent cyclone shelters and identified more than 7,000 public buildings as temporary shelters to house people. The India Meteorological Department has said that all fishing operations should be suspended in Odisha and West Bengal until the 20th of May. IMD has also barred movement in motorboats and small ships.
मैं आपको ये जानकारी दूं कि 1999 के बाद जितना साइक्लोन बने हैं बे ऑफ बंगाल में, ये सबसे इंटेंस साइक्लोन रहा है। सुपर साइक्लोन के बाद ये सेकेंड सुपर साइक्लोन है 99 के बाद। सो इसलिए अकॉर्डिंगली हम हेवी रेनफॉल वार्निंग दिए हैं। 19 मई के लिए उड़ीसा में हम हेवी टू वेरी हेवी रेनफॉल दिए हैं, स्पेशली जगतसिंहपुर, केंद्रापड़ा, जाजपुर, बालासोर, भद्रक, मयूरभंज डिस्ट्रिक्ट्स, और आइसोलेटेड हेवी रेनफॉल दिए हैं खोर्धा और पुरी डिस्ट्रिक्ट्स। 20 मई के लिए हम नॉर्थ उड़ीसा का जो डिस्ट्रिक्ट्स है, भद्रक, बालासोर, मयूरभंज, जाजपुर, केंद्रापड़ा एंड केवंझर डिस्ट्रिक्ट्स के लिए हेवी टू वेरी हेवी रेनफॉल रखे हैं। सो वेस्ट बंगाल का बात करें, जहां सबसे ज़्यादा रेनफॉल होने का हम उम्मीद कर रहे हैं, वहां 19 को रेनफॉल शुरू होगा। मैनी प्लेसेस में लाइट टू मॉडरेट रेनफॉल रहेगा और आइसोलेटेड हेवी रेनफॉल हो सकता है कोस्टल एरिया में, स्पेशली ईस्ट मेदिनीपुर, साउथ एंड नॉर्थ 24 परगना। बट 20th इज चैलेंजिंग डे है, उसमें बारिश के साथ तेज हवा रहेगा और स्टॉर्म सर्ज रहेगा। हम एक्सट्रीमली हेवी रेनफॉल 20th मई को एक्सपेक्ट कर रहे हैं और डिस्ट्रिक्ट्स है ईस्ट वेस्ट मेदिनीपुर, साउथ नॉर्थ 24 परगना, हावड़ा, हुगली, कलकत्ता एंड एडजॉइनिंग डिस्ट्रिक्ट्स।
And talking about the latest COVID-19 numbers, 8 weeks into the lockdown, the number of infections in India crossed 1 lakh on Monday. Over 4,500 new cases and 134 deaths were reported in the last 24 hours. 2,350 COVID-19 patients were cured in this period. So far, over 39,000 patients have recovered, while there have been 3,163 deaths linked to COVID-19 so far. This has given a recovery rate of 38.73%. India currently has over 58,800 cases under active medical supervision. Only 2.9% of these cases need intensive care. According to the ICMR, 1 lakh people were tested for COVID-19 in the last 24 hours for the first time. Over 24 lakh coronavirus tests have been conducted so far in the country. India has 7.1 coronavirus cases per 1 lakh people so far, as against 60 globally and about 0.2 deaths per lakh population. This compares to approximately 4.1 deaths per lakh population for the world. According to experts, the 1 lakh cases has been delayed by almost 3 weeks due to the nationwide lockdown, first imposed on the 24th of March. However, as lockdown restrictions get progressively eased, the number of cases reported daily are rising. COVID-19 tally is worst in Maharashtra, where the numbers rose to 35,058 with the detection of 2,033 new cases. 51 fresh deaths have taken the toll to 1,249 as per the State Health Ministry data. 536 new coronavirus cases were reported in Tamil Nadu. This brings the total reported cases of coronavirus in the state to 11,760. Among the total people infected, 4,406 have recovered, while 81 have died. 366 new coronavirus cases were reported in Gujarat, bringing the total number of cases to 11,745. Among the people infected, 4,804 have recovered. There have been 694 deaths. 500 more COVID-19 cases were reported in Delhi in the last 24 hours. The total number of cases are now 10,554, including 5,638 active cases and 166 deaths so far. In the biggest ever spike in Karnataka, 127 COVID-19 cases were confirmed, taking the total number of infections to 1,373 in the state. 3 deaths have been reported, taking the death toll to 40. COVID numbers are also rising in states like Bihar, Rajasthan, West Bengal and also Uttar Pradesh.
The Maharashtra government has issued new set of guidelines for the fourth phase of lockdown. Accordingly, the state government has permitted e-commerce essential and non-essential activities in red zones.
E-commerce essential and non-essential activities in red zones, all industrial units and construction sites in red zones, sports complexes, stadia and other public open spaces will remain open for individual exercise in non-red zones. But spectators and group activities are banned. Intra-district bus service with maximum 50% capacity is allowed in non-red zones. People can step out for essential activities. Otherwise, movement between 7 p.m. to 7 a.m. is prohibited in Mumbai. Home delivery of liquor is allowed. However, no liquor shops will be open in Mumbai to prevent violation of social distancing norms. Offices have been urged to practice staggered working hours, work from home and regular sanitization procedures. But the city's lifeline, the local trains, are shut. Educational institutions, places of recreation like shopping malls, cinema halls, cab services such as Ola and Uber and religious places are shut till the 31st of May. Citing the high number of coronavirus cases, Tamil Nadu government is continuing lockdown restrictions in 12 districts including capital Chennai. Taxis and auto rickshaws will be permitted only for medical purposes. To travel in these areas, Tamil Nadu e-pass is mandatory. Lockdown restrictions have been eased in the state's remaining 25 districts. People in these districts do not need the state government e-pass for travelling. Buses, cabs and auto rickshaws can also ply on roads. Industries with less than 100 employees can operate with 100% workforce. Those with more than 100 personnel can work with 50% staff. The new relaxations for industries applies to all regions in Tamil Nadu barring Chennai. Movement of individuals is prohibited from 7 p.m. to 7 a.m. and travel to hill stations is banned. Schools, colleges and religious places will also remain closed. Uttar Pradesh allowed reopening of vegetable markets with proper precautions for 3 hours from 4 a.m. to 7 a.m. Retail vegetables can be sold between 6 a.m. to 9 p.m. Street vendors and hawkers have also been permitted to function in the state. Restaurants are allowed to operate but only for home delivery. The UP government said movement from Delhi to Noida or Ghaziabad will be allowed except when the person is travelling from a containment zone. However, Noida administration said the Delhi-Noida border will remain sealed and no traffic movement except for emergencies will be allowed. Gujarat has allowed no relaxations in containment zones where only shops selling essential items will remain open. 50% shops and offices in the non-containment zone can remain open between 8 a.m. and 4 p.m. but they need to follow the odd-even formula. The government has also allowed reopening of barber shops and salons in non-containment zones. Resumption of bus and auto rickshaw services across the state, barring a few places, was also announced. Haryana has made it mandatory for anybody entering the state to first go through a coronavirus test. A person will only be allowed to enter Haryana if he or she tests negative for the coronavirus.
As many as 169 Indian nationals, including 119 female students, arrived in Srinagar from Dhaka on Tuesday evening in a special repatriation flight of Air India under the Union government's Vande Bharat mission.
This was the second flight from Bangladesh under phase 2 of the mission, evacuating Indians stranded due to the outbreak of the coronavirus pandemic and subsequent lockdown. Earlier on Monday, the first flight evacuated 169 stranded Indians in Bangladesh to Kolkata.
We thank the principal and the Indian High Commission Bangladesh for taking our responsibility and helping us to get through this hard period and making sure that we're doing fine in the hostels and providing us they're providing us enough food and everything. And all the process that has been going on to take us home, we thank the Indian authority and everybody who has been in this process.
Another Air India Express flight carrying 243 passengers arrived in Visakhapatnam from Manila at 8:30 p.m. 179 people arrived in Hyderabad from Bahrain at around 8:30. Meanwhile, Ariana Afghan Airlines also brought back Indian nationals from Kabul to Delhi. 6 special flights are bringing home over 1,000 Indian nationals stranded in Gulf countries of Saudi Arabia, UAE, Kuwait, Bahrain and Qatar. 2 flights from Saudi Arabia, Riyadh to Kozhikode and Dammam to Kochi, will bring home around 300 passengers later tonight. The Dubai-Delhi flight is expected to evacuate around 175 people, while the flights from Kuwait and Doha will bring back around 350 people to Kannur. Priority is being given to distressed blue-collared workers, medical emergency cases, pregnant women, stranded tourists and the elderly people. Only those found asymptomatic will be allowed to board the flight. More than 40 flights from the Gulf countries are being operated during phase 2 of the Vande Bharat mission.
The government has made such an arrangement that Indians who are coming from abroad should be taken to their nearest town. Like a flight will come from Kuala Lumpur, it will go to Bengaluru, and from Bengaluru it will also go to Ahmedabad. Similarly, a flight from Manila will come, it will go to Mumbai, and from Mumbai it will go to Visakhapatnam. Again, a flight from London will come to Mumbai, or from Mumbai it will go to Kochi tomorrow. And San Francisco flight will go to Delhi, from Delhi it will go to Bengaluru, and from Bengaluru it will go to Hyderabad day after tomorrow. Akhilesh Suman for Rajya Sabha television in Delhi.
In the fight against novel coronavirus, 8 candidate vaccines are currently in the clinical evaluation phase, while 110 are in the pre-clinical evaluation phase.
American biotechnology company Moderna Inc., the University of Oxford, US-based Inovio Pharmaceuticals and China-based CanSino Biologics are ahead in the race to develop the coronavirus vaccine. US-based biotech company Moderna's vaccine candidate is the latest to enter clinical trials. On Monday, it said interim data from a phase 1 trial showed that all participants had produced COVID-19 antibodies. Further, the vaccine candidate also provided full protection against viral replication in the lungs in a mouse challenge model. China-based CanSino Biologics became the first contender to move its candidate vaccine into a phase 2 clinical trial in Wuhan. The company said it is now moving to phase 2 based on preliminary safety data from phase 1. The University of Oxford has also shown positive results with its COVID-19 vaccine candidate that involves 6 rhesus macaque monkeys. Experts exposed these monkeys to the SARS-CoV-2 virus. The trial offered hope as the vaccinated monkeys had less virus in their lungs and airways. The vaccine candidate is being tested on more than 1,000 volunteers aged between 18 and 55 in a phase 1 trial since last month. UK's Imperial College of London is developing a vaccine in a form that has not been tested before in people. The team has been testing with animals since early February and is due to begin human trials in June. However, it cautioned on Monday that a vaccine will not be available before September in the UK. US biotech company Inovio Pharmaceuticals is currently testing INO 4800, a DNA plasmid vaccine with electroporation, as a vaccine against coronavirus. It says its candidate vaccine resulted in promising immune responses in preclinical models. The company has now enrolled 40 healthy people for its phase 1 trial. It is hoping it could advance to phase 2 and 3 efficacy trials by this summer. Clinical trials for COVID-19 vaccine by 3 other contenders are under the clinical evaluation phase. These include trials led by Wuhan Institute of Biological Products, Sinopharm, Beijing Institute of Biological Products, Sinopharm and Sinovac. The Sinopharm group is a Chinese pharmaceutical giant. Meanwhile, Indian multinational pharmaceutical and biotechnology company Cipla Limited is working on various multiple therapies for treating coronavirus. The Mumbai-based company is working out the finer details of its pact with Gilead Sciences Inc. on the experimental antiviral drug Remdesivir. Remdesivir is only allowed for emergency usage by the US FDA to treat COVID-19. Experts at AIIMS in Bhopal have also been conducting drug trials for coronavirus treatment with promising results. The trials of the drug Mycobacterium W were conducted on COVID-19 patients for the last few days. In India, over 30 Indian vaccines are in different stages of development, with a few going on to trial stages. The Indian Council of Medical Research has also teamed up with Bharat Biotech International Limited for developing COVID-19 vaccine. In general, a candidate vaccine goes through development stages, which include exploratory stage, preclinical stage, clinical development, regulatory review and approval, manufacturing, and quality control. Among these, clinical development is a three-phase process. In phase 1, small groups of people receive the trial vaccine. In phase 2, the study is expanded and the vaccine is given to people who have characteristics like age and physical health similar to those for whom the new vaccine is intended. And in phase 3, the vaccine is given to thousands of people and tested for efficacy and safety. Bureau Report, Rajya Sabha TV.
As India observes Lockdown 4.0, AIIMS Director Dr. Randeep Guleria, who is closely involved in building strategies for prevention and containment of COVID-19 in India, has said that the national lockdown is a significant strategy to contain the spread of coronavirus. Speaking exclusively to Rajya Sabha TV, Dr. Guleria said the focus should now be more on hotspots and reclassification of zones in order to bring down the number of COVID-19 cases in the country.
Dr. Guleria, welcome to Rajya Sabha Television and thank you so much for joining us.
In an exclusive conversation with Rajya Sabha Television, Dr. Randeep Guleria, a renowned pulmonologist and part of the core team of top officials reviewing and monitoring the pandemic in India, has said that stringent lockdown has stopped the number of cases from exponentially rising in the country. He said the lockdown has ensured that India's rate of growth was much slower than most of the European powers and even the US.
I think this lockdown is very important for two reasons. One reason is that it's given some freedom as far as economic growth is concerned, but with that freedom comes responsibility also. And it's important for all citizens to realize their responsibility, whether it's going out wearing a mask, whether it's social or physical distancing, or whether it's regular hand washing. At the same time, it has put some restrictions in place, like the metro or the air travel, so that we can prevent the chain of transmission and not have a surge in number of cases. The focus, of course, has to be in the red zones or the containment areas, because that's where bulk of our cases are coming from. And if we can actually prevent the increasing number of cases in these areas, we will actually be able to decrease the number of cases in our country and at the same time allow some degree of the economy to restart.
Dr. Guleria also said that there has been a massive improvement in healthcare infrastructure in the country, but the challenge for the country will now be to keep the rate of growth in infections and the mortality rate in check for the next few weeks.
So if we continue to see increasing number of cases, it will indirectly mean that there will be increased strain on the hospitals. So we have to start getting our hospitals totally ready. We have to have things in place. And we have to see how can we focus or redistribute our resources in those areas where the cases are becoming more and hospital requirement will be much more. Remember, there are large parts of our country where there have been very few cases or the cases have started coming down. So we need to see how can we reallocate our resources to those areas, the so-called hotspots or the containment zones, where there is going to be an increasing need for health resources as compared to other areas which are relatively stable and the cases actually are coming down in these areas.
Dr. Guleria says that India has to work aggressively to get community participation and find ways to implement this new normal of social distancing and economic activity. Kriti Mishra's report for Rajya Sabha TV.
The World Health Assembly has agreed to an independent investigation into the World Health Organization's response to the global coronavirus pandemic.
At the agency's annual ministerial meeting, none of the WHO's 194 member states raised objections to the resolution brought by the European Union on behalf of more than 100 countries, including Australia, India and Japan. Besides a scientific investigation into the origins of the virus, the resolution calls for an impartial, independent and comprehensive evaluation into the international response to the corona pandemic. Earlier, WHO Chief Tedros Adhanom Ghebreyesus said an independent evaluation which would look at what lessons could be learned and put forward any recommendations would take place at the earliest opportunity. Monday, the first day of the summit, saw the US criticizing China and the WHO over the coronavirus outbreak. US Health Secretary Alex Azar accused the WHO of letting COVID-19 spin out of control at the cost of many lives. Under mounting global pressure, China relented on its opposition for an inquiry into the origin of the coronavirus. China's President Xi Jinping yesterday in his address at the summit said that his country would support a comprehensive review of the COVID-19 pandemic, but only after the outbreak has been brought under control.
Through this resolution, actually World Health Organization could be saved from a major showdown, confrontation or disgrace. Now it will be up to the scientific communities of the world who will decide whether the point of origin and point of outbreak were the same, whether the coronavirus came from horseshoe bat or pangolin, and finally whether the role of WHO was reasonably good amidst this outbreak and after that, or whether World Health Organization needs some change in its style and attitude. Akhilesh Suman for Rajya Sabha Television in Delhi.
After weeks of lockdown, countries worldwide have now begun easing restrictions. In an attempt to restore normalcy, Italy further eased restrictions on Tuesday. Museums, restaurants, shops, cafes and hair salons have reopened across the country. People have also started visiting beaches, while churches have also begun holding masses. Similarly, other countries are also gradually easing down their lockdown restrictions.
Spain is executing a 4-phase lockdown exit. On Monday, Madrid and Barcelona eased restrictions. Stores can now open without appointments, while museums have been allowed to reopen with limited capacity. France and Germany have proposed a €500 billion recovery fund to boost economies hit by the pandemic. The fund will be used to help European member states and regions that are affected by the outbreak. Greek archaeological sites, including the Acropolis, also reopened on Monday. Shopping malls and high schools are functioning even as travelling across the mainland has been permitted. Restaurants and bars will open on the 25th of May. Meanwhile, the European football clubs have resumed training. Premier League clubs resumed training on Tuesday, while Real Madrid has begun group training. The United States is also in the process of gradually easing lockdown measures. Non-essential retail businesses and non-essential construction resumed operation in some states, while others have reopened gyms. On Monday, car plants and the auto industry also resumed work. Mexico has also issued guidelines for restarting operations in the automotive, mining and construction sectors. More than 4.9 million COVID-19 cases have been recorded worldwide, while the death toll has crossed 3.2 lakh.
The Jammu and Kashmir administration has issued rules for issuing domicile certificates in the Union Territory.
According to the J&K Grant of Domicile Certificate Procedure Rules 2020, people belonging to West Pakistan, Valmikis, women marrying outside communities, non-registered Kashmiri migrants, displaced people will now get domicile. Further, under the new rules, any person who has resided for a period of 15 years or has studied for a period of 7 years and appeared in class 10th or 12th examination in an educational institution located in Jammu and Kashmir will also be eligible for the certificates, among others. Also, children of central government officials, all India service officers, officials of PSUs, public sector banks, officials of statutory bodies, officials of central universities and recognized research institutes of the central government who have served in the UT for 10 years will be eligible for domicile status in the Union Territory. Domicile certificate will be granted to migrants and their children registered with Relief and Rehabilitation Commissioner. Children of those residents of Jammu and Kashmir who stayed outside in connection with employment of business or other professional or vocational reasons are also now eligible for grant of domicile status.
कि 70 वर्ष से रह रहे पश्चिम पाकिस्तान से आए हुए हमारे ही नागरिक अपने आप से को नागरिकता के अधिकार से वंचित किए हुए थे। आईपीएस ऑफिसर्स, इंडियन फॉरेस्ट सर्विस ऑफिस, प्रत्येक राज्य में ये व्यवस्था है कि जो व्यक्ति 30-35 वर्ष अपनी सेवा देता है पूरी निष्ठा ईमानदारी के साथ और प्रतिबद्धता के साथ जिस प्रदेश में, जिस राज्य में, उसे वहाँ पर रहने का अधिकार होना चाहिए रिटायरमेंट के बाद भी।
Welcoming the step, BJP National President JP Nadda on Tuesday said, the new rules will give long due rights to all refugees as well as to Kashmiri Pandits who live outside the Union Territory. He also added that the amended rules will ensure equality and dignity for all.
And that's it from us in today's bulletin. Thank you very much for your time. Take good care of yourselves and your families.